Hello and welcome to this podcast from the BBC World Service. Please let us know what you think and tell other people about us on social media. Podcasts from the BBC World Service are supported by advertising.
Hello and welcome to Health Check from the BBC, the show with the latest global health news. I'm Claudia Hammond. A new report estimates that 1 in 7 adolescents around the world are experiencing a diagnosed mental health difficulty. As France holds a global mental health summit, we ask what can be done while countries have so many other competing priorities, such as COVID.
COVID-19 has really raised the visibility and importance of mental health, and many governments, and in fact, now view mental health and psychosocial support as a critical and life-saving component to their COVID-19 response. We know that by tackling poverty, we are going to support the mental health of communities.
Later on, we'll hear from young people in Belize and Peru talking about their mental health. And a new exhibition exploring where research on cancer is getting us. But it's not only the science that matters. Today, we're taking an ethical look at all these issues with my guest, Deborah Bowman, who is Professor Emerita of Bioethics and Clinical Ethics at St George's University of London. How are you, Deborah?
I'm very well, Claudia, and how are you?
I'm good, thank you. Now, there are always ethical issues to take into account when a new drug is discovered, especially one that saves lives. And just the other day, the US drug maker Merck announced the results of trials of a pill to treat COVID. A pill which, unlike current treatment, you could take at home before you even became seriously ill. The tablet is called Molnupiravir, and here's the Chief Science Officer at Merck, Dr. Daria Hazuda, explaining why she thinks it's special.
It is the first oral antiviral to have shown efficacy in the outpatient setting for COVID. It's a very interesting drug in that it actually gets incorporated into the genetic material of the virus and introduces errors. The errors make the virus less able to replicate. And because of this unique mechanism of action, molnupiravir has very broad spectrum activity. So it is active not just against COVID-2, but is active, across multiple coronaviruses and as well as influenza and several other RNA viruses. And it is anticipated to work broadly across any variants because the variants that are emerging with mutations in a different part of the virus, the part that the immune response recognizes, which is very different from the target that molnupiravir works against. So we're truly excited about the results from the Move Out trial in COVID. We've been scaling up large supplies. We also entered into licensing agreements with low-cost manufacturers to make the drug available globally to many countries where vaccination rates are actually quite low.
The results haven't been published in a scientific journal yet, but outside monitors did halt the trial once it became apparent that the drug seemed to be cutting the risk of hospitalisation or death by about half. If it is approved by regulators, it will be the first oral antiviral medication for COVID-19. Now, in the trial, twice as many patients taking a placebo ended up in hospital, and no one who took the new drug died. So could this be a game changer? Peter Horby is Professor of Infectious Diseases at Oxford University.
Well, it's really, very promising news. So far, the antivirals that have worked have been intravenous infusions or injections under the skin. So having a pill that can be used in the community, would really make a difference. So very good news. But I would say it's interim data on a relatively small number of patients. So about 775 patients that they've got this result in, and they saw a big reduction in the risk of hospitalisation. So the risk was reduced by 50%, but the absolute numbers, were relatively small. So it was, 14% hospitalised or died versus 7% in the treatment arm. I think we do need to see a bit more data to be really confident with the result.
So, Deborah, there seems to be cautious optimism there, and obviously regulators will look very carefully at the data, but on the face of it, it does sound like good news. Now, it's interesting that the trial was halted early, because that can happen, can't it, when drugs are very successful or when they're very unsuccessful? How does that come about?
Absolutely. So it happens because there are ethical considerations in both directions, if you like. So if something's very successful, the ethical question is it ethical to continue a trial when we have a demonstrable benefit and the process of the trial might effectively delay that benefit to the maximum number of people. So that's clearly a balance, because you have to have a good enough understanding, for example, of risks as well as potential benefits to decide whether you're going to halt the trial. So that's if things are looking promising, as it sounds like in this case. If things aren't going well, then clearly the ethics are different. And actually, it's deemed to be unethical to continue, partly because of the participants, of course, the people who are at risk and giving themselves, if you like, as volunteers to research, but also because the chances of that drug ever being able to be used and have the benefit, or indeed the intervention, it need not necessarily be a drug, are very slim. So there has to be an ethical rationale for research rather than treatment in both cases.
Now, if this pill does get licensed, of course, it's the case while COVID is fatal for a few and makes some people very ill, it's very mild and often even symptomless at all for others. So are there extra considerations when you're, in effect, having to treat people with it so early that they're people who might become ill, but they're not really ill at the moment?
It's really interesting, isn't it? And especially when a drug is new. So although it looks at the minute, from what we know, absolutely accepting the limitations to what we know, and that is important, that this is a drug that appears to be well tolerated. We don't know that. So there are questions about how you can consent to a drug that's relatively new, when you've got no symptoms, and when actually you don't know your risk profile or indeed the risk you might present to others. And that last bit's important here as well, because COVID we've always had this, that there are so-called public health ethics and then the ethics of treatment of an individual. And COVID has, if you like, really demonstrated to us that that's quite an arbitrary distinction, because, of course, there's a risk to us as individuals, and that might be variable, but there's the risk that we present to others. And we might be completely asymptomatic, but encounter somebody unknown to us who is very vulnerable. So there's something about the relationships there. I mean, for me, it comes down, the essential question is, what's the benefit? To whom? Is it sufficient? And what do we know and not know? And actually, I just don't think we have answers to those questions at the moment. So I think Peter used the word promising. And I guess from an ethics point of view, I want to understand exactly what that promise is and see how we know, or what we know about when that promise might be delivered and what the cost of that might be. Because even with the best drug in the world, there is always an ethical cost, if you like.
And I guess there'll also be questions about how to use this alongside vaccination and what sorts of decisions about it individuals might make if there's a pill available instead or as well.
Indeed. And my understanding, and I'm not an expert in this at all, but my understanding is that vaccination is still the gold standard, if you like. It's still what we would like everybody in the world to have access to. And it's great if we have a pill that might be easier and more accessible in parts of the world that haven't necessarily had easy access to vaccines. But there might be an unintended consequence in that the social justice imperative, if you like, to provide equitable access to vaccines, i.e. the gold standard, momentum might be lost and people might not see that as important. And then, of course, there are questions about breakthrough disease in, say, vaccinated people. My understanding of this trial so far is that it's been with the unvaccinated, and there are good methodological reasons for that. But is this a drug that we would use for people who had breakthrough infection, who were already vaccinated, who might therefore be said to be getting a double benefit because they live in a particular part of the world, while there are fellow human beings in other parts of the world who don't have access to either?
Yeah, so lots of different aspects to consider there. Thank you very much, Deborah, and do stay with us. Now, every one of us has had a different experience of the pandemic depending on our situation. But new research conducted in 21 countries by Gallup for UNICEF suggests that during the first half of 2021, 1 in 5 15 to 24-year-olds said they often felt depressed or had little interest in doing things. And UNICEF estimates that 13% of adolescents currently live with a diagnosed mental health problem. France is holding a global mental health summit at the moment in Paris, and Zainab Hijazi, who is UNICEF's senior mental health technical advisor, joined me from there and told me why mental health is such a significant issue.
Globally, in high income and in low and middle income countries, mental health conditions, and very importantly, Claudia, the lack of caring responses remain the cause of significant suffering for children. Mental health conditions are the top cause of death, disease, and disability, especially for our older adolescents. We know that 13% of adolescents globally are estimated to have a mental disorder, and anxiety and depression make up about 40% of these diagnosed mental disorders. And the startling statistic that 45,800 adolescents ages 10 to 19 die from suicide every year. I mean, worldwide, suicide is the 5th most prevalent cause of death for adolescents ages 10 to 19. And so, when we're asked whether mental health services are life-saving, they most certainly are.
Yes, and I think some of those figures will really surprise people. And one of the young people you've been speaking to at UNICEF is Andre, who's 14 and lives in Peru.
I live in Coyique in my aunt's house with my mother in a small room that we both share. I like to listen to music, to play, to read about different things. I would also like to make a big change in this society.
I went to pick him up from school. Out came the psychologist and he said my son needed psychological help. That day he didn't feel well. He was under a desk crying and saying he didn't want to keep on living.
After asking me a few questions at the health centre, they figured out what I had. They were a big help. Mainly, I think it was good that they listened to me.
My son's very lively, always joking. He talks a lot. He's a very smart kid, and I've always told him that.
It's better to have good mental health than trying to live a lie, saying that you're okay when you really aren't.
How typical is a story like Andre's? Obviously, everybody is different, but I guess there are a lot of people in his situation.
Yeah, absolutely. And, interestingly, COVID has shown a bright light on mental health as an issue. And now the youth are telling us they want a platform to speak, they want to be heard, they also want to help us make a difference. And so one of the wonderful things about Andre's story is that it highlights the critical need to make mental health services accessible and affordable. Unfortunately, for many children, especially in poor and low and middle income countries, we find that mental health services are often centralized within capitals. We have a shortage of mental health specialists. So Andre's story tells a story of integration of mental health into primary health care so that they are then able to ensure that communities and children have access to the support that they need.
And as part of your report, children were interviewed in 21 different countries. And I was interested to see that in Cameroon, Mali, Indonesia, Zimbabwe, France and Germany, between a quarter and a third of 15 to 24-year-olds say they often felt depressed or had little interest in doing things. And that compared with only about 10% of young people in Japan, Ethiopia or Spain. Why do the figures vary so much between countries?
It's really important to stress that, the graphs and the figures and all these numbers, they're not dry data. They represent real lives. I think it's really critical to be very careful in the way that we read data and be very cautious when reading results. And especially, when we see this different pattern that you stated, COVID-19 has demonstrated that it hasn't really been very uniform across countries. And even within the same communities where you might have pockets or neighborhoods that are disproportionately impacted, the data is not always representative.
Yes, so in some ways it's very hard to get an exact picture of what is happening. And I guess, as you mentioned, each of those individual lives are going to be affected by events that are happening in that country and in their lives. And I know you've been supporting projects in Lebanon with children who've been affected by the explosion in Beirut.
Yeah, Lebanon is kind of this convergence of humanitarian crises, with the influx of Syrian refugees, also political instability. And then came this blast that really disabled all the infrastructure that we had built within the country to prioritize mental health. And After the blast, it was very clear that integration within primary healthcare was critical indeed, but we needed to also be looking at more of a comprehensive approach, integrating mental health into school curriculums and training of social workers. We organized interactive sessions with youth on coping with the aftermath of the Beirut blast, and we've reached over the last year around 2 million people through those sessions.
Now, in terms of what can be done in general, we're going to hear now from Sahar in Belize, and she is now 25 and works with children, but she knows what it's like to experience mental ill health as a teenager.
I was in my third year of high school, and then things really started to fall apart, having trouble leaving the house. And in my senior year, I had to withdraw from high school because I was fainting. I couldn't eat. It really was a tough time. I thought I was dying. But after doing several tests, it was evident that there was nothing physically wrong with me. It was a mental illness. In terms of my psychiatrist, she was mainly prescribing medication, figuring out what works for me. And with my psychologist, she was teaching me how to cope with all this anxiety and depression I was feeling. And also, it was someone to air out my